Infertility is a common problem among couples trying to have children.
All Note 6, KVUE's Jim Bergamo is here with some of the expected and somewhat surprising causes of infertility. Jim?
Hi there, Tyler, Terry. Well, too much exercise, caffeine, even where men place their laptop computers, can significantly impact a couple's chances of getting pregnant.
That's great. That is just great.
Candace Beersmith was in her late 30s when she and her husband decided it was time to have children.
It's very exciting. My husband and I had actually been together 18 years. So, it was something we really didn't decide until we got into our late 30s to have children. We thought we would be one of those couples that just didn't have children and traveled. And then, it was something I really had to think about and decided that I didn't want, to live my life and not have children.
But after a year and a half of trying without success, Candace knew the clock was ticking.
And being an older female, I did feel like I wanted to, see what my options were, because I didn't have, 5 to 10 years to wait for it to happen on its own.
So Beersmith made an appointment with Dr. Thomas Vaughn of the Texas Fertility Center. He explained a variety of things can negatively impact a couple's fertility, some known, some not so well known. Things like not enough exercise. But did you know too much exercise can also hurt fertility chances? Most couples know to avoid alcohol or illegal drugs, but how many are aware too much caffeine can negatively affect fertility? And Dr. Vaughn says even the heat from a laptop computer can significantly lessen a man's sperm count.
All of those things can affect women's cycles in these crazy ways. And I think until you really start tracking yourself and tracking things, you don't realize how your diet and your daily activities and your daily, environmental issues, affect your day-to-day life and end result your fertility.
As for Candace's difficulties in getting pregnant,
she was a little bit more unexplained. She does all the right things and didn't have any of those bad habits, and so there wasn't really much to do to fine-tune her behavior, if you will.
Candace's problem was in her fallopian tubes, which affected her ovulation. She and her husband opted for in vitro fertilization and got pregnant after the first procedure.
And I think the end result of being pregnant, it almost makes it even more enjoyable, because you know that this child was definitely wanted and loved, and it was not the easiest way to get to this point.
Well, the good news is Candace is just 2 months away from delivering a baby boy. Dr. Vaughn, the first fertility specialist in Austin, says while there's not much data on brushing and flossing teeth that helps fertility, once a woman does become pregnant, he says there's strong evidence indicating poor oral hygiene can lead to an increased risk in premature babies.